I want to talk to you today about something that could make all the difference in how you experience your later years. If you're over 65 or approaching that milestone, this conversation is for you. And if you have parents or loved ones in this age group, please share this with them, because what I'm about to tell you could genuinely transform their quality of life. You see, turning 65 isn't about slowing down or accepting decline. It's about making smarter choices that honor where you are in life. But here's the thing. There are certain habits and behaviors that can seriously undermine your health, independence, and happiness after 65. Some of them might surprise you because they seem harmless or even beneficial. Today, I'm going to walk you through 10 things you should absolutely avoid after age 65, and I'll explain exactly why they matter and what you can do instead. Before we dive in, I want to ask you something. What's the one health goal you have for yourself or a loved one right now? Maybe it's staying active, keeping your mind sharp, or simply maintaining your independence. Whatever it is, drop it in the comments below. I read them, and I love hearing from you, because your stories and questions help shape the content I create. Now let's get into it. The first thing you should never do after 65 is ignore regular health screenings and checkups. I know. You might be thinking, I feel fine. Why do I need to see a doctor? But here's what most people don't realize. Many serious health conditions develop silently in your 60s and beyond. We're talking about things like high blood pressure, diabetes, certain cancers, osteoporosis, and even cognitive decline. These conditions often show no symptoms in their early stages, but catching them early can mean the difference between simple management and serious complications. After 65, your body changes in ways that require closer monitoring. Your immune system isn't as robust as it once was. Your bones may be losing density. Your cardiovascular system is under more cumulative stress. Regular screenings allow your healthcare provider to catch problems before they become crises. I'm talking about annual physicals, blood pressure checks, cholesterol panels, diabetes screening, colonoscopies, mammograms, bone density tests, eye exams, and hearing tests. These aren't just suggestions. They're essential tools for maintaining your health and independence. The real danger in skipping these appointments is that you're essentially flying blind. You might feel okay today, but problems could be brewing beneath the surface. And by the time symptoms appear, treatment options may be more limited or more aggressive than they would have been with early detection. So please, make those appointments. Put them in your calendar like the important commitments they are. Your future self will thank you for the vigilance you show today. The second thing you must avoid is becoming sedentary and stopping regular physical activity. This is huge, and I can't stress it enough. After 65, the temptation to slow down and rest more can feel natural. Maybe your joints ache a bit. Maybe you feel tired more easily. Maybe retirement has removed the structure from your days. But here's the truth. Inactivity is one of the fastest paths to decline in older adults. When you stop moving, you lose muscle mass at an accelerated rate. You lose bone density. Your balance deteriorates. Your cardiovascular health suffers. Your metabolism slows even further. And perhaps most concerning, your risk for chronic diseases like diabetes, heart disease, and even dementia increases significantly. Research shows that regular physical activity after 65 can reduce your risk of premature death by up to 30%. It improves your mood, your cognitive function, your sleep quality, and your overall independence. The key is understanding that exercise doesn't mean you need to run marathons or lift heavy weights, though if you can and want to, that's wonderful. For most people over 65, the goal is consistent, moderate activity. I'm talking about walking for 30 minutes most days of the week, doing gentle strength training with light weights or resistance bands twice a week, practicing balance exercises to prevent falls, maybe adding some flexibility work like stretching or yoga. Swimming and water aerobics are fantastic because they're easy on the joints. Even gardening, dancing, or playing with grandchildren counts as activity. The worst thing you can do is convince yourself that you're too old to exercise or that rest is what your body needs most. Yes, you need adequate rest, but you also need movement to maintain the strength, balance, and endurance that keep you independent. If you haven't been active, start small. A 5-minute walk around your neighborhood is better than nothing. gradually increase as you build confidence and stamina. And please, talk to your doctor before starting any new exercise program, especially if you have existing health conditions. But don't let fear or discomfort keep you on the couch. Movement is medicine at any age, and it's especially critical after 65. The third thing you should never do is isolate yourself socially. Loneliness and social isolation are what I call silent epidemics among older adults, and their health effects are staggering. Studies have shown that social isolation can be as harmful to your health as smoking 15 cigarettes a day. It increases your risk of heart disease, stroke, depression, anxiety, cognitive decline, and even premature death. After 65, it's easy for social connections to fray. Maybe you've retired and no longer have daily workplace interactions. Maybe friends have moved away or passed away. Maybe mobility issues make it harder to get out. Maybe you've lost a spouse. These are real challenges, but withdrawing into isolation is not the answer. Human beings are social creatures at every age. We need connection, conversation, laughter, and shared experiences to thrive. Social engagement keeps your mind active and sharp. It gives you purpose and meaning. It provides emotional support during difficult times. It even boosts your immune system function. So what can you do? Make social connection a priority just like you would exercise or eating well. Reach out to family regularly, whether through calls, video chats, or visits. Join community groups, clubs, or classes that interest you. Many communities have senior centers with activities ranging from card games to art classes to group exercise. Volunteer for causes you care about. It gives you purpose while connecting you with like-minded people. Consider getting a pet if you're able. They provide companionship and can even help you meet other people. Attend religious services or spiritual gatherings if that's meaningful to you. Take classes at a local community college or library. Start or join a walking group. The specific activity matters less than the consistent social interaction it provides. And if you're struggling with grief, depression, or anxiety that's making it hard to connect with others, please reach out for professional help. There's no shame in talking to a counselor or therapist. In fact, it's one of the smartest things you can do for your mental and physical health. Remember, staying socially connected isn't just about feeling good in the moment. It's about protecting your brain health, your emotional resilience, and your physical well-being for years to come. Number 4. Never ignore your mental health or dismiss emotional struggles as just part of aging. This is something I feel passionate about because there's still so much stigma around mental health, especially among older adults. Many people in this age group grew up in an era when you just toughed it out or kept your problems to yourself. But ignoring mental health issues doesn't make them go away. It makes them worse. Depression, anxiety, grief, and stress don't discriminate by age. In fact, older adults face unique challenges that can trigger or worsen mental health conditions. You might be dealing with the loss of loved ones, adjusting to retirement and a change in identity, coping with health problems or chronic pain, facing financial concerns, losing independence or having to move from your home. These are significant life stressors and they take a toll. Here's what concerns me most. Depression in older adults often goes unrecognized and untreated because symptoms can look different than in younger people. Instead of sadness, you might experience more physical complaints, memory problems, lack of motivation, or irritability. Family members and even doctors sometimes mistakenly attribute these signs to normal aging or dementia when they're actually treatable symptoms of depression. Untreated mental health issues don't just affect your mood. They impact your physical health, your cognitive function, your relationships, and your quality of life. Depression can weaken your immune system, worsen chronic pain, interfere with medication compliance, and increase your risk of suicide. In fact, older adults, particularly older men, have some of the highest suicide rates. This is a serious issue that we need to talk about openly. The good news is that mental health conditions are highly treatable at any age. Therapy works. Medication can help when appropriate. Support groups provide community and understanding. Lifestyle changes like exercise, social connection, and purpose-driven activities make a real difference. If you're struggling, please talk to your doctor. Be honest about how you're feeling emotionally, not just physically. If your doctor doesn't take your concerns seriously, find one who will. You deserve support. There's no weakness in seeking help. In fact, it takes tremendous strength and wisdom to recognize when you need assistance and to reach out for it. Your mental health is just as important as your physical health, and caring for it is one of the most important things you can do after 65. The fifth thing to avoid is poor nutrition and not paying attention to what you eat. Nutrition becomes increasingly important as you age, yet many people over 65 fall into eating patterns that undermine their health. Sometimes this happens because cooking for one or two feels like too much effort. Sometimes it's due to a reduced appetite or changes in taste and smell. Sometimes it's about budget constraints or difficulty shopping and preparing food. And sometimes people just don't realize how their nutritional needs have changed. Here's what you need to know. After 65, your body processes nutrients differently. You need fewer calories because your metabolism has slowed, but you actually need more of certain nutrients. You need adequate protein to maintain muscle mass and strength. You need calcium and vitamin D for bone health. You need fiber for digestive health. You need vitamins B12, which becomes harder to absorb with age. You need healthy fats for brain function. You need antioxidants to fight inflammation. At the same time, you need to be more careful about things like sodium, which affects blood pressure, added sugars, which contribute to diabetes and inflammation, and processed foods, which are often nutritionally empty. Poor nutrition after 65 has serious consequences. It can lead to unintentional weight loss and muscle wasting, a condition called sarcopenia. It weakens your immune system, making you more susceptible to infections. It contributes to chronic diseases like diabetes and heart disease. It can worsen osteoporosis. It affects your energy levels, mood, and cognitive function. So what should you do instead? Focus on eating whole, nutrient-dense foods. Fill your plate with colorful vegetables and fruits. Choose whole grains over refined ones. Include lean proteins like fish, chicken, beans, and eggs. Don't fear healthy fats from sources like olive oil, nuts, avocados, and fatty fish. Stay hydrated, because thirst sensation decreases with age, and many older adults are chronically dehydrated. If you're having trouble shopping or cooking, look into local resources. Many communities have meal delivery programs for seniors. Some grocery stores offer delivery services. Meal prep services can simplify cooking. If appetite is an issue, talk to your doctor. Sometimes medications affect appetite or taste. Sometimes dental problems make eating uncomfortable. Sometimes underlying health conditions are at play. These are all addressable issues. And please, don't fall for fad diets or extreme restrictions unless medically necessary. Your goal at this stage of life isn't to achieve some arbitrary weight. It's to nourish your body with the fuel it needs to stay strong, energetic, and healthy. Food is medicine, and the choices you make at every meal either support your health or undermine it. Number 6. Never ignore changes in your cognitive function or memory. This is something that worries many people as they age, and understandably so. You forget where you put your keys. You walk into a room and forget why. You struggle to remember a word. And immediately you think, is this normal aging, or is this something more serious? Here's the truth. Some mild cognitive changes are a normal part of aging. Processing speed slows a bit. Multitasking becomes harder. Recalling names or words might take longer. But significant memory loss, confusion, difficulty with familiar tasks, problems with language, poor judgment, personality changes, these are not normal parts of aging. These could be signs of mild cognitive impairment or dementia, and they need to be evaluated. The biggest mistake people make is ignoring these warning signs or dismissing them as inevitable. They might feel embarrassed. They might be afraid of what they'll learn. They might not want to burden family members, so they hide the problems or make excuses. But here's why early evaluation is so critical. Not all cognitive problems are due to Alzheimer's disease or irreversible dementia. Sometimes memory issues are caused by treatable conditions like vitamin B12 deficiency, thyroid problems, depression, medication interactions, sleep disorders, or even dehydration. Addressing these underlying causes can restore cognitive function. Even when cognitive decline is due to Alzheimer's or another form of dementia, early diagnosis matters. It allows you to access treatments that can slow progression and manage symptoms. It gives you time to make important legal and financial decisions while you're still able. It helps your family understand what's happening and plan for future care needs. It opens doors to clinical trials and research studies, and it allows you to be proactive about lifestyle changes that support brain health. So if you're noticing concerning changes in your memory or thinking, or if family members have expressed worry, please get evaluated. Start with your primary care doctor. They can do initial screening and refer you to a specialist if needed. Don't wait. Don't minimize. Your cognitive health is precious, and protecting it requires the same attention you give to your heart health or any other aspect of your well-being. In the meantime, there are things you can do to support your brain health. Stay physically active, because exercise increases blood flow to the brain. Keep learning and challenging your mind with puzzles, reading, learning new skills, or taking classes. Maintain social connections, because meaningful relationships stimulate cognitive function. Manage cardiovascular risk factors like high blood pressure, diabetes, and high cholesterol, because what's good for your heart is good for your brain. Get quality sleep, because that's when your brain clears out toxins. Eat a brain-healthy diet rich in omega-3 fatty acids, berries, leafy greens, and whole grains. Protect your head from injury. And manage stress. Your brain has remarkable plasticity even in later life, and the choices you make today can influence your cognitive trajectory. The 7th thing you must never do after 65 is neglect your oral health. I know this might seem less critical than some of the other things we've discussed, but hear me out, because your oral health is intimately connected to your overall health in ways that might surprise you. After 65, many people experience dental problems. Maybe they've lost teeth. Maybe they have gum disease. Maybe they can't afford regular dental care because Medicare doesn't typically cover it. Maybe mobility issues make it hard to get to the dentist, so they skip appointments, ignore problems, or just accept poor oral health as part of aging. This is a serious mistake. Poor oral health is linked to numerous systemic health problems. Gum disease, which is inflammation and infection of the tissues that support your teeth, has been associated with heart disease, stroke, diabetes complications, respiratory infections, and even dementia. The bacteria from infected gums can enter your bloodstream and contribute to inflammation throughout your body. Missing teeth or poorly fitting dentures can affect your ability to eat nutritious foods, leading to poor nutrition. Dental pain can interfere with sleep and quality of life. Oral health problems can also affect your confidence and social interactions, contributing to isolation. And certain medications common in older adults can cause dry mouth, which increases the risk of cavities and gum disease. So what should you do? First, maintain regular dental checkups and cleanings even if you think everything is fine. Most people should see a dentist at least once or twice a year. Your dentist can catch problems early when they're easier and less expensive to treat. Brush your teeth twice a day with fluoride toothpaste and a soft bristled brush. Don't brush too hard, as this can damage gums. Floss daily to remove plaque between teeth where your brush can't reach. If traditional flossing is difficult, try floss picks or a water flosser. If you have dentures, clean them daily and remove them at night to give your gums a rest. Keep your mouth moist. Drink plenty of water throughout the day. If medications are causing dry mouth, talk to your doctor about alternatives or use saliva substitutes. Avoid tobacco in all forms. Smoking and chewing tobacco dramatically increase your risk of gum disease and oral cancer. Limit sugary and acidic foods and beverages. If you're having trouble affording dental care, look into local resources. Some communities have low-cost dental clinics. Dental schools often offer reduced-cost care provided by supervised students. Some states have programs that help seniors with dental costs. Don't let financial concerns prevent you from seeking care, especially if you're in pain or have an infection. Your mouth is the gateway to your body, and keeping it healthy protects your overall health. It's not vanity, it's essential preventive care. Number 8. Never stop challenging your mind and learning new things. There's a saying that if you don't use it, you lose it, and this is especially true for cognitive function as you age. After 65, some people fall into a mental rut. They stick to familiar routines. They watch TV for hours but don't engage in activities that challenge their thinking. They stop seeking out new experiences or learning new skills. This mental stagnation is risky because your brain, like your muscles, needs regular exercise to stay strong. When you challenge your mind with new and complex activities, you're building what neuroscientists call cognitive reserve. This is essentially your brain's resilience, its ability to maintain function even as age-related changes occur. People with greater cognitive reserve are better able to delay the symptoms of dementia and cognitive decline. So how do you build cognitive reserve after 65? Learn new skills that are challenging and unfamiliar. Take up a musical instrument. Learn a new language. Try painting or drawing. Study photography. Take a cooking class focused on a cuisine you've never tried. Master a new technology. The key is that it should be novel and require sustained attention and practice. Read regularly and widely. Mix fiction and nonfiction. Join a book club to discuss what you read, because that adds another layer of cognitive engagement. Do puzzles and games that require problem-solving and strategy. Crosswords, Sudoku, chess, bridge, strategy-based video games. These all provide mental workout. Engage in meaningful conversations and debates. Discussions that require you to think critically, consider different perspectives, and articulate your thoughts are excellent for cognitive health. Travel if you're able, or explore new places in your own area. Novel environments stimulate your brain in ways that familiar settings don't. Volunteer or work part-time in roles that are mentally engaging. Take classes through community colleges, senior centers, or online platforms. Many universities offer programs specifically for older learners. Teach others something you know well. Teaching requires you to organize information and explain concepts, which is cognitively demanding. The worst thing you can do is convince yourself that you're too old to learn or that it's not worth the effort. That's simply not true. Your brain retains the ability to form new neural connections throughout life. Learning might take a bit longer than it did when you were younger, and that's okay. The process of learning is what provides the benefit. Every time you challenge your mind with something new, you're investing in your cognitive future. You're building the reserves that will help you maintain your independence and quality of life. So stay curious, stay engaged, keep learning. Your brain will thank you. The 9th thing to avoid after 65 is mismanaging your medications or not understanding what you're taking and why. This is a critical issue because medication management becomes increasingly complex as you age. Many people over 65 take multiple medications prescribed by different doctors for different conditions. You might be taking something for blood pressure, cholesterol, diabetes, arthritis, depression, and sleep, plus over-the-counter supplements and pain relievers. This is called polypharmacy, and while medications are often necessary and life-saving, taking multiple drugs increases the risk of problematic interactions, side effects, and errors. Here's what goes wrong. People forget to take medications or take them incorrectly. They don't understand what each medication is for. They experience side effects but don't report them to their doctor. They take medications prescribed years ago that may no longer be appropriate. They mix prescriptions with over-the-counter drugs or supplements without realizing there could be interactions. They see multiple doctors who don't communicate with each other about what's being prescribed. They can't afford all their medications, so they skip doses or stop taking things without telling their doctor. All of these scenarios can have serious health consequences. Missing doses of critical medications, like those for heart disease or diabetes, can be dangerous. Taking medications incorrectly can make them ineffective or harmful. Drug interactions can cause everything from mild side effects to life-threatening complications. And some medications that were appropriate at age 65 may not be appropriate at 75 or 80 because your body processes drugs differently as you age, and your kidney and liver function may decline. So here's what I want you to do. Create a complete list of every medication you take, including prescriptions, over-the-counter drugs, vitamins, and supplements. Note the dose and how often you take each one. Keep this list updated and bring it to every doctor appointment. Use one pharmacy for all your prescriptions if possible, so they can screen for interactions. Make sure every doctor you see knows about all the medications you're taking. Ask questions about each medication. What is it for? How should I take it? What side effects should I watch for? What should I do if I miss a dose? Are there foods or other medications I should avoid while taking this? Review your medications with your doctor at least annually. Ask if everything you're taking is still necessary. Sometimes medications can be discontinued safely or doses can be adjusted. Never stop taking a prescribed medication without talking to your doctor first, even if you feel fine or think you don't need it anymore. Some medications need to be tapered gradually to avoid withdrawal effects or rebound symptoms. If you're having trouble affording medications, tell your doctor. There may be less expensive alternatives, patient assistance programs, or generic options. Use a pill organizer to help you remember what to take when. Set alarms on your phone as reminders. If swallowing pills is difficult, ask your doctor or pharmacist if your medications come in liquid form or if tablets can be crushed. Report side effects promptly. Sometimes what you think is a new health problem is actually a medication side effect. Your doctor can only help if they know what you're experiencing. Proper medication management isn't complicated, but it requires attention and communication. Don't be passive about this. You're the CEO of your own health, and understanding what goes into your body is a fundamental responsibility. And finally, number 10. Never ignore fall prevention and home safety. This might not sound as serious as some of the other things we've talked about, but please listen carefully, because falls are one of the leading causes of injury, disability, and loss of independence in people over 65. Every year, millions of older adults fall. Many of these falls result in fractures, particularly hip fractures, which can have devastating consequences. After a hip fracture, many people never regain their previous level of mobility and independence. Falls can also cause head injuries and trauma. Beyond the physical injuries, falls often trigger a fear of falling again, which leads people to limit their activities. This creates a dangerous cycle of reduced activity, weaker muscles, worse balance, and even higher fall risk. Here's the thing: most falls are preventable. They're not random acts of bad luck. They happen because of a combination of factors, including muscle weakness, balance problems, vision issues, medications that cause dizziness, home hazards like loose rugs or poor lighting, rushing, and unsafe footwear. So what should you do to protect yourself? First, assess your home for hazards. Remove throw rugs or secure them with non-slip backing. Keep floors clear of clutter, electrical cords, and obstacles. Improve lighting throughout your home, especially in hallways, stairways, and bathrooms. Use nightlights so you can see if you get up at night. Install grab bars in the bathroom near the toilet and in the shower or tub. Use non-slip mats in the tub or shower. Make sure handrails on stairs are secure. Keep frequently used items within easy reach so you don't have to climb or overreach. Work on your strength and balance. The exercises I mentioned earlier aren't just about general fitness, they're specifically protective against falls. Simple balance exercises like standing on one foot or walking heel to toe can make a real difference. Tai Chi has been shown in research to reduce fall risk. Have your vision checked regularly and keep your prescription up to date. Poor vision significantly increases fall risk. Review your medications with your doctor because some drugs, particularly sedatives, sleep medications, and some blood pressure medications can increase fall risk. Wear proper footwear. Avoid walking around in socks or slippery slippers. Wear shoes with good support and non-slip soles, even at home. Take your time. Many falls happen because people rush to answer the phone or get to the bathroom. It's okay to move deliberately and carefully. When you stand up, especially from lying down, do it slowly. Sit on the edge of the bed for a moment before standing. This prevents dizziness from sudden blood pressure changes. If you're recovering from an illness, surgery, or hospitalization, be extra careful because these situations can temporarily affect your strength and balance. Consider using assistive devices if you need them. There's no shame in using a cane or walker if it helps you stay safe and mobile. These devices can actually increase your independence by allowing you to move around confidently. And don't keep them hidden in the closet. Use them. If you do fall, tell your doctor even if you weren't injured. A fall can be a warning sign of an underlying problem like a medication issue, vision problem, or neurological condition. Your doctor can investigate and help prevent future falls. Taking fall prevention seriously isn't about living in fear. It's about being proactive and smart so you can maintain the active, independent lifestyle you want. Your safety matters, and simple modifications can make a tremendous difference. So there you have it. 10 things you should never do after age 65. Let me recap them quickly. Never ignore regular health screenings and checkups. Never become sedentary and stop physical activity. Never isolate yourself socially. Never ignore your mental health or emotional struggles. Never neglect proper nutrition. Never ignore changes in cognitive function or memory. Never neglect your oral health. Never stop challenging your mind and learning new things. Never mismanage your medications. And never ignore fall prevention and home safety. I know that's a lot of information, but here's the beautiful thing. You don't have to do everything perfectly or tackle all of this at once. Pick one area where you know you need to make a change and start there. Small, consistent steps lead to big improvements over time. The message I really want you to take away from this is that so much of how you experience your later years is within your control. Yes, aging brings changes. Yes, you may face health challenges. But the choices you make every single day matter profoundly. You have more power than you might think to protect your health, maintain your independence, and enjoy a high quality of life. I've worked with countless people who have transformed their health and vitality by making the kinds of changes we've talked about today. People who went from sedentary to active and gained years of mobility and strength. People who addressed depression and rediscovered joy. People who made fall prevention changes and avoided the injuries that might have ended their independence. People who stayed socially connected and maintained sharp minds well into their 80s and 90s. This can be you. Your age doesn't define you. Your choices do. So I want to encourage you to be intentional. Be proactive. Don't wait for problems to force your hand. Take charge of your health now. And remember that taking care of yourself isn't selfish. When you prioritize your health and well-being, you're better able to enjoy time with loved ones, pursue your interests, contribute to your community, and live the life you've worked so hard to build. You've earned these years. Make them the best they can be. If you found this information helpful, please share it with someone who needs to hear it. Leave a comment below telling me which of these 10 areas resonates most with you, or what health goals you're working on. I love hearing from you, and your engagement helps this content reach more people who can benefit from it. Thank you so much for watching. Here's to your health, your vitality, and your best years ahead. Take care of yourself, because you're worth it.